poster presentation. We are really excited to roll out conversation between you and the scholars. This is the way that we culminate the Source Service Scholar Program. And if you're unfamiliar, this program places students with a community-based organization for an entire academic year where they serve as project managers. And we are really excited to hear from everyone in this year's cohort. So I'm going to stop talking. I'll turn the floor over to our scholars who will speak TED Talk style for 5 minutes. Feel free to drop any questions that you have for the scholars in the chat. We'll note them and then provide them to the scholars at the end of our session. And then Tony will lead us out. So thanks, everybody. Our very first scholar is Anna.
Hi, everyone. Let me just share my screen. Okay, can you guys all see that? Okay, perfect. So my name's Anna Peeler. I'm a PhD student in the School of Nursing and had the pleasure of being a service scholar this year. My community-based organization is Soccer Without Borders, and I've had the most fun with them. The director is Emily Sherman, and my sort of direct supervisor is Kat Sipes. So thank you both so much for all of your support. But basically, a little bit about the CBO. Soccer Without Borders is a nonprofit whose mission is to use soccer as a vehicle for change, providing underserved youth with a toolkit to overcome obstacles to growth, inclusion, and personal success. So they use soccer coaching, educational support, create a safe and inclusive environment for immigrant and refugee children in the Baltimore area. They have satellite offices, I guess, in other cities as well. So my project was to create a curriculum and conduct social and emotional learning circles for the players. So I started last semester by coming up with the curriculum. I guess the Source Service Scholar before me came up with some good resources, and then I applied those to create a curriculum, an 8-week curriculum to teach social and emotional learning. So we started with one group of middle school boys, and the whole goal of social and emotional learning is to help the players acquire and apply knowledge, skills, and attitudes to develop healthy identities, manage their emotions, interact with other people in a healthy and positive way. So we did the circles with middle school boys first in the fall, and it went well. So we expanded we were hoping to have 4 groups, but with the volunteers, it ended up we just have 3 groups. But now we're doing middle school boys, high school boys, and middle school girls. So it's been really great. Typically the lessons last for about 30 to 45 minutes. And then we apply the lessons that we've learned to 30 minutes of soccer. It's super fun. I feel like the kids are really learning a lot. And it's a great positive environment to be a part of. So basically what I've learned from this, sometimes outdoor activities can be a little bit challenging, especially with, COVID and weather and kids' schedules. Volunteer recruitment can be a little bit difficult too, so it requires consistent engagement and communication. But overall, I've had the best time with Soccer Without Borders, and I really appreciate the opportunity to be part of the Source Service Scholars.
Estelle, thank you so much, Anna. If you have any questions for Anna, please drop them in the chat and we will have our question session at the end. Next up, we have Ekene.
Hi, folks. Good evening. I'm just going to share my screen. Can folks see? Awesome. Okay. So, hi, everyone. My name is Ekene. I am a student at the School of Public Health, and I had the opportunity to work with Commodore John Rogers Elementary School and elementary and middle school as my community-based partner, and my preceptor was Hannah Wallace. And in working with the school and coming up with the project itself, one action area that the school had in mind was to be able to build in some social engagement opportunities for their young students. As everyone's kind of experienced with COVID, we've all shifted to this like online remote reality. And I feel like that disrupts a lot of kind of like how, you know, people and students are able to engage with one another. So the school really wanted to build in ways for our young learners who are our pre-K students and our K students to be able to still feel connected even though we're remote learning. And so in talking with my preceptor, staff at the school, as well as the teachers, what we've kind of came up with is this CJR Doodle Club, which is basically an after-school virtual art program for our pre-kindergarten and kindergarten students so that they're able to, you know, get creative while at home, but also use art as a way to kind of connect and with one another through the ways that they're able to express their thoughts and emotions via art. And so in collaboration with both teachers and volunteers, the project kind of took on 2 different phases. So first started out with the planning phase, where we kind of just really fleshed out the concept of like what kind of art activities would we be doing, how long would the sessions last, and just making sure at a foundational level that, you know, all of the students would be able to have access to art supplies. And so once we were able to do that, we were then able to kind of move into a kind of implementation phase. And so what I have here under activities and accomplishments is an example of what we were able to do. So we were able to kind of create lesson plans that covered specific topics. And so here I have an example of a recent session that we just covered, which was on patterns. And so we had lesson plans, we had an associated PowerPoint that was interactive for the students. And using these 2 components, we'd hold sessions online virtually. And the students loved it. I think just the fact that they're able to draw and be creative really gave them an outlet to, you know, be able to be creative with each other. So throughout the session, we would draw and then everyone would kind of hold up like what they were doing, and that's kind of shown in the picture down below. So overall lessons that I gained from this opportunity was just how important it is to kind of get input from people who are both directly and indirectly involved in any project, because it's so enriching to hear the different sides and goals that people have with this project. And that's necessary in order to bring it to life. And the final really big point that I learned was how amazing kids are. They're so resilient. I mean, even with shifting to online learning, Zoom fatigue is so real, but the kids came to every session pumped and ready to just engage with one another. So it was very fun for me and the students, and I'm very appreciative of this opportunity. So thank you for your time.
And thank you for your presentation, Akane. Next up, we have Alicia.
Hello, everybody. I'll time myself. Hello, my name is Alicia Ramirez. The title of my Service Scholar project is Navigating Health Insurance While Seeking Transgender Affirming Care. The project was done in partnership with the community-based organization Free State Justice, and my supervisor was Ezra Halstead. The organization goals. So Free State Justice works to advocate for the rights of LGBTQ people in Maryland. The goal of this project was to pilot a survey to gather the experiences of transgender individuals navigating health insurance while seeking transgender affirming care. The goal was created to fill gaps found in a needs assessment survey that was done by the organization in 2016. The results of the finalized survey will be used in a new needs assessment that Free State Justice plans to do at a later time. So the process, I started off by reviewing insurance research and insurance policy information that was gathered by a previous intern at the organization. I also read through a case that was found on a Facebook group page about someone navigating insurance themselves after originally getting services denied for transgender affirming care. So with this insight, we then worked to create a draft survey to gather more experiences from individuals who have had experiences navigating insurance on their own or with help from a provider or healthcare organization to see what the process was like for them. Once we had a draft survey created using Google Forms, we sought feedback from individuals in the Hopkins community or in the Baltimore community, both LGBTQ and non-LGBTQ folks who have some knowledge on the insurance landscape in Maryland. We received feedback and took some recommendations from the feedback to incorporate into the survey before it gets finalized. So such feedback including a section to discuss how the process of navigating healthcare as a transgender individual has affected the person mentally, and also delineating whether we want to ask questions about transgender related care or transition related care, as both are separate things. So for impact, I take pride in creating a survey that asks these sorts of questions that can be used by the organization to create advocacy initiatives around this topic. Oftentimes, one may think that just because insurance companies say that they will cover transition-related care procedures doesn't mean that this process is easy to understand or to initiate. It can be a very complex web with various hoops that an already marginalized individual must navigate. So for sustainability in the future, a community outreach/promotional plan will be created to explain what the survey is, how it can benefit the community, and overall promotion and distribution of the survey throughout Maryland to individuals who identify as non-binary or transgender. And then as a personal takeaway, I really enjoyed learning about health insurance landscape in Maryland and about the difficulties of getting transition-related care. There is definitely more work that needs to be done in this area, and I feel glad that I was able to impact a small portion of that work. So some of the volunteer feedback or some of the volunteer questions that we asked in the survey were: what else is the survey missing? What would you like to see asked? And how well were the goals of the survey met? And some lessons that I learned throughout this process were adapting to change, being open to new ideas, being flexible, and keeping the larger picture in mind. And although the project had changed throughout my time with Free State Justice and Source, I continued to stay on board because I wanted to continue this work with the CBO, and I found this project really interesting. Thank you.
Thank you, Alicia. We appreciate your presentation. Next up, we have Jane.
Hi, give me 1 second. Sorry, let me share my screen. I am doing I have made a PowerPoint. Apologies, it was going so smoothly.
No worries. We're all fumbling with technology every day. You're doing great.
Thank you. Okay, nope. Gosh darn it. 1 second. Okay. There we go. So that's good. I'm going to, all right. So my project was with the Nursing Public Health Network, which is kind of a bridge between a CBO and a Hopkins affiliated organization. So their organization goal is to connect people from the nursing and schools of nursing and public health, from students to faculty and alumni, to emphasize the interconnectedness of healthcare workers and their goals. So the initial plan was to create a spoken word event to reflect on the intersectionalities between healthcare and social determinants of health and being a member of the Baltimore community. Since the pandemic, this has evolved into something called 2020 Talkback, engaging social justice through creative writing. So the project development involved considering how to bridge issues of social justice, healthcare, and expressing oneself creatively, and then deciding on and deciding who to target. We decided to focus on young people who, during this pandemic, may feel isolated and feel like their voices don't matter. So we decided to create a writing workshop that would help youth process the trauma of 2020. And then we developed the workshop and pilot tested it both in the Hopkins community and in association with another community-based organization. So the workshop objectives overall were to find bridges between our own lives and the various news events and occurrences within the larger community and find connections between them, and to then to find a creative voice to create that bridge, and also to give work feedback. And eventually 2 workshops were held, one within the Hopkins community with 4 total attendees, 2 of whom were able to stay for the creative writing portion of the workshop, and then another one with living classrooms where unfortunately, due to timing and Zoom fatigue, we only had 1 student in attendance, but she had a great time. This event also had a collaboration with a local Baltimore poet who came in, gave a performance, and then also presented some of her own workshop experiences. So lessons learned is really going from a nascent idea into a final project, and learning how to be behind the scenes of a creative workshop and how to emphasize and create space. This was also an opportunity to collaborate with various members of the Baltimore community from various organizations, artists, and young people, and then also being flexible and making adjustments in the age of planning things via Zoom. And then also continuously reminding myself that I am the right person to do this task. And for sustainability, this workshop has been made into a single-page handout, which I hope to distribute to various youth-based CBOs, and hopefully this workshop can continue to be held even without me, because we are all still processing 2020. And that's my presentation. Thank you.
Great job. Thank you so much. Next up, we have Lakaya. We give folks rounds of applause. I see some emojis. I'm loving these presentations. Folks are doing great jobs. Thank you to all the scholars. Okay.
Okay, just working on sharing my screen. Can everyone see that? Awesome. Okay. So, hello, my name is Lakaya Santhara, and I'm a first-year medical student at Hopkins. And for my Source Scholars project, I worked with the Baltimore International Rescue Committee, or the IRC, specifically to empower refugee youth in our community. And so to give a little bit of background, the IRC is a global nonprofit organization providing high impact and cost-effective solutions, which include housing, employment, and education for refugees and anyone that's affected by crises, including persecution, war, or environmental disasters. And the IRC in Baltimore runs multiple programs such as resettlement, community integration, economic empowerment, and also educational programs for the children and youth in the community. And the Refugee Youth Mentorship Program, or RYMP for short, which I believe is actually unique to Baltimore, is this program that I specifically worked with. And in this program, they pair 10 refugee youth with 10 mentors from the Baltimore community. And this can be anyone from students, in undergrad, graduate students, or working professionals in the community, to help the refugee students out with homework assignments, or guide them in things such as college applications, or even getting a driver's license, like how to go about doing something like that. And also just to simply be kind of a friend, and someone to rely on as these mentees settle into the United States. So the goal of my project was to help run and organize the weekly RYMP meetings, and kind of help create something that could have a more long-term and sustainable impact on the participating youth. So I did this by planning a career opportunities panel for the refugee youth, so that they could kind of glean ideas and get some advice and some inspiration about things that they might be interested in pursuing in the future potentially, or just, see ideas of students and like what they can go forward to and do if they pursue higher education, or, some kind of training after finishing high school. So just to kind of give you guys an idea of what I did, some of the activities that I was kind of responsible for were helping to organize and run weekly RYMP sessions every Wednesday, and then helping brainstorm ideas for new meeting formats. And this could be anything like pairing together groups of coaches and mentees to discuss final projects, just, to change up the format and keep things interesting before the formal programming for the night. And then I also conducted midway and final check-ins with the mentors to see if they had any thoughts or suggestions to improve the program for future cohorts. I recruited some volunteer coaches from my med school class, and also ultimately obviously organized the panel, which is kind of my final project, which involved recruiting volunteers from different Hopkins schools, as well as students actually beyond the Hopkins system, to kind of speak about their experiences and talk to the students. So I would say that my biggest takeaways from this experience were that communication is key, which I think is something that everyone has realized over the course of this project. Number one, because the difficulties of COVID have really emphasized how important communication can be, in taking action to really make sure that there is clear communication, both in terms of working with the mentees and mentors in the program, but also just between me and my CBO. And then also, I think the language barriers that exist when working with refugees made this a little more challenging as well. So this was an interesting thing for me to navigate. And additionally, I think even in something as simple as a weekly mentorship program, I think that I learned innovation is really key, because coming up with new formats and activities for the students was really essential to keeping them engaged. And I think that the full effect of this program is best realized when the mentees, stayed interested and invested and showed up to all the weekly sessions and got their certificate at the end. So I think that this was really important. And also obviously patience and flexibility when working with the CBO as well as the mentees. So to make sure that my project is sustainable, I'm putting together a database of speakers and questions that we ask, so that future panel organizers can reference these resources when planning. And also the mentees can have contacts to reach out to in the future. So I just wanted to thank Source for giving me this wonderful opportunity, and my CBO contacts, Beta and Felix, for being so great, and also the volunteers, and of course the mentees, without whom none of this would have been possible. So thank you so much.
Thank you so much. Next up, we have Sydney.
Okay, do you guys see that in full screen? No? Okay, hold on one second. Oh my goodness, what's going on? What about now? Hold on, working on it.
Doing great.
You still see it in this weird presenter mode?
Just click swap view at the top.
Okay, how do you do that? Reading view, slideshow. Amazing. Okay. So hold on one second. How did that happen? Oh, okay, so my name is Sydney, and I worked with Henderson Hopkins, which is a partnership school with Hopkins. It is located like right behind the School of Nursing. I'm a School of Nursing student. I'm getting my Master's of Science in Nursing in about 12 days. And I worked with Annie Weber, and she is in charge of like community outreach. She does actually a lot. Her job is not just one specific thing. But Henderson Hopkins is named after Elmer Henderson, who was a very important Baltimore educator. And the point of the partnership school is really a relationship of reciprocation. So Henderson Hopkins receives a lot of funding and a lot of help from the Hopkins community. And the hope is that in return, they would build this kind of relationship. So basically, the purpose of this project was to bring service learning into Henderson Hopkins in the middle school. It was present, it was infused into the hours, and it was already a part of the school. But Annie really saw this vision of bringing it in and making it this big culture, so that service learning is kind of just a thing that everybody does and that everybody understands, and it's just a way of being. In Maryland, to graduate high school, you have to have 75 service hours. So the hope is that if you start in middle school, you're like easily meeting those hours. It's not even something that needs to be thought about, like, how do I meet those hours? It's just, look at all this service learning that I just do on a daily basis. So initially we met a lot of barriers. The first barrier that stuck out to me was kind of debunking the idea and dealing with the kind of privileged history of service learning. A lot of the time, service learning requires money, it requires transportation, it requires time. So when we were building the foundation, Annie and I really had to think about, how do we propose activities that don't require money, that don't require students to travel really far, and that can be done in like short spurts of time and don't necessarily require parental involvement a whole lot, because we do know that a lot of these parents are working, and they're working on the weekends and they're working at nights, and they don't necessarily have time to assist their kids with service learning, no matter how important they think it is. So initially we had 3 big project aims. So like I said, to foster an environment where service learning at Henderson Hopkins is not only centered, but also accessible. And then to create bonds with community-based organizations in hopes of future opportunities. And then the last is creating this service learning manual. And initially we were really ambitious. We started compiling a list of 200 organizations in a 2-mile radius of Henderson Hopkins that we thought would be really great for students to interact with. And we slowly realized that we just didn't have the capacity to meet with or engage with all of those organizations. So we picked a handful of organizations. Just some examples are like Civic Works, Movable Feasts, Meals on Wheels, the Sixth Branch, Cards for Hospitalized Children, and Be More Children. And we mainly focused our energy on those organizations and building community with them, and talking about how they can accommodate Henderson Hopkins students and service learning. And so that was like the beginning of that project. And then to continue our work, the real tangible item that we created was this service learning manual. And in this service learning manual, we explain what service learning is, what the requirements are, and then the different components that are required to actually earn your hours. And then we propose activities that some of the students can do. And we also give a list of like approved organizations. So that was kind of what we ended up doing with our time. And what needs to happen in the future is it really needs to be put into action. So now we have all these resources, we've started this work, but now we have to share with the community and get it out there. And one of the things that the assistant principal, JD Merrill, kept saying to Annie and I was, life doesn't stop because of COVID. Like, service learning doesn't stop just because it's COVID. You need to be innovative and creative and find service learning tasks and activities and moments that students can do despite having to be at a distance or virtually. So that was probably one of our biggest hurdles. And I think it's a testament to Annie and I's creativity and partnership that we were able to find and create activities that can occur in COVID and during this pandemic and perhaps our foreseeable next few years, and also really a framework so Henderson Hopkins can begin to have this culture of service learning.
Thank you so much, Sydney. Great job. Next up, we have Christina.
Only if I can figure out how to stop sharing. Where'd you go?
Hello, everyone. All right. So my name is Christina Versino, and my community-based organization was the Green Healthy Homes Initiative. And so to start out with a little bit of a background, GHHI is a Baltimore-based nonprofit that it began with a focus on ending childhood lead poisoning. And then Green Healthy Homes, so today now has evolved into a national organization that works to kind of integrate lead hazard control with a lot of other services such as weatherization, mitigating other healthy home hazards like mold or something like that, as well as weatherization, energy efficiency, and aging in place programs. And I came to actually the Source Scholars Program already a big fan of Green and Healthy Homes for some of the direct services that they provide. But what I learned early on was that they don't just do these services, they also do a lot of policy work and advocacy too. And so in this particular case, Green Healthy Homes had noticed a problem. It had been difficult to find and hire contractors to work in Baltimore, and there didn't seem to be many new contractors that were entering the field. So Green Healthy Homes was looking for a student to speak to stakeholders and identify potential barriers that existed that were potentially preventing people from being able to enter. So those stakeholders would include individual contractors, workforce development programs, also Green Healthy Home staff who had a lot of insight actually to share across cities too, and some other nonprofit employees in Baltimore. And so down here in the green, I'd written some of the steps of this process, from getting to speak to stakeholders and synthesize their perspectives in a report that Green Healthy Homes could use to kind of inform future directions for their organization, advocate, and as well as, it was very exciting for me to give a little bit of input for the incoming Biden administration back in January. And so there's also one wonderful curveball in this project that came in the form of a contracting organization called Appalachian Field Services, actually reaching out through Source. So again, the Source service scoop is going far, and reaching out how they'd actually kind of wanted to create a potential partnership with Green Healthy Homes, because they'd been interested in creating more resources for entrepreneurship in Baltimore. And that had actually previously been identified as a gap in the resources available from my discussions with workforce development programs. And so with the help of a lot of volunteers and Green Healthy Home staff, as well as AFS, the contracting company itself, the product is now under consideration as one of the things Green Healthy Homes may try to take on in coming years, as well as the many things that they already do. So to be determined. And then the last thing I'd kind of want to go over here is just the lessons learned. And so one of the major takeaways was how much social needs and resources interact and are kind of one and the same as workforce development. So for example, not having access to food or stable housing or transportation, those things can impact someone's ability to work. And making those things accessible can be a really important form of workforce development. Another thing that this project's really hammered home was how important it is to involve people who are directly impacted in programs and policies, in the creation of those programs and policies, not just kind of like really having a voice in making those and in funding those. And finally, just how much historic marginalization in Baltimore City has impacted the present for residents and businesses in Baltimore. So there are a bunch of people I want to thank because I've had so much help along the way, and I really could not have done anything without Kelsey and Jamal from Green and Healthy Homes, Kiala, my source advisor, and then of course many volunteers. So thank you.
Thank you. Great job, Christina. Excited for Jeffrey to be up next. While he sets up, I'll just say a big shout out to all of our amazing preceptors who made these opportunities possible for our scholars. We are recruiting for new projects for the next cohort. So with that, I'll turn the floor over to Jeffrey.
Thank you. Hi, everyone. My name is Jeffrey. I'm a medical student at Stanford and a MPH candidate at Johns Hopkins. And today I'll be talking about how we utilize community networks and barbershops and salons to address the COVID-19 vaccine hesitancy within Baltimore. For context, this project initially started out as the hypertension project, and the idea was to do health education and hypertension screenings within local barbershops, and it was a part of a national initiative started in UPenn's chapter in Philadelphia, West Philly, and we were planning on implementing the similar thing within East Baltimore. However, due to the COVID-19 pandemic, had a lot of shifting and pivoting to do. And throughout the year, recognized that doing in-person screening was not going to be very likely or feasible with the current restrictions. And so we shifted to doing, continuing the educational component, but focusing on a very relevant topic, which is the COVID-19 vaccine. And as we know, especially earlier on, there were higher reported rates of vaccine hesitancy within Black and Brown communities. And so we thought this would be a great way to address health equity by promoting greater education surrounding the COVID-19 vaccines. To do so, we had established a relationship already for the purpose of the Hypertension Project with the 1009 East Lombard Street Barbershop. It's a very well-established barbershop with strong community roots. And in speaking with them, there were a lot of the barbers there that expressed interest in addressing the misinformation that was currently being spread around the COVID-19 vaccines. And after deciding that this would be a good topic to dive into, we ended up developing a Qualtrics survey that we used, and then developing a QR code that people could scan at the barbershop. In case that came up, we would put this at each of the we did put this at each of the barbershop, like on the dresser or on the shelf next to where they were practicing and cutting hair. And this would give people a chance to, scan this, and it just said like interested in the COVID-19 vaccine, skeptical of the COVID-19 vaccine. And then people would scan that code and be taken to the survey. And then once they went to the survey, the QR codes linked them to this questionnaire that provided links to social media materials on TikTok, Instagram, YouTube, written information with frequently asked questions, as well as Q&A panels with experts, or just to send their email to say, I'm interested in learning more, who can I find out more about this from? And then that form, again, allowed people a chance to reach out to Johns Hopkins public health students or medical students if they had further questions. As of now, this was distributed to the 1009 East Lombard Street Barbershop, as well as a few salons in the area. And the barbershop clients were able to engage in this public health discourse by viewing the educational videos and accessing written information on the websites. In terms of lessons learned, it was really important that we had these pre-established relationships. And for us, we were really able to leverage what 1009 East Lombard Street Barbershop has built over decades in trust in the East Baltimore community, and being able to use that in a safe and I think approachable way, such that, we were providing information. We weren't telling people you need to sign up here, this is what you need to do, but rather here's the information that we have. These are safe vaccines. They have been tested in people of color. I myself actually was a member of the Pfizer clinical trial. And so I think that, having that discussion really allowed us to build connections and start to rebuild trust in areas where there is distrust from a history of medical experimentation and a lack of transparency with regards to the intentions of the Hopkins Research Institution. In terms of implications, this really just hit home the idea that having community roots is really strong, can really overcome a lot of the barriers that we have to accessing medical information, and that medical literacy is super important in making sure that we address the needs of the patients and the community members and are not just giving information that's not accessible. And so, yeah, that's basically it for the project. And we're looking forward after this to kind of pivoting back to hypertension, but also we're really proud of the way that we were able to address a current need and a growing issue within Black and Brown communities here in East Baltimore. And thanks to all of our, especially our community partners, Quentin and Coop, who allowed us to access their communities. Thanks to the Source Scholars Program for the opportunity and for building this relationship, and to our faculty mentors, Drs. Cujo and Piggott, who served as our advisors. And then thanks again to Tony for helping me in the decision to pivot and for giving me advice along the way. And I have my email there for any questions or comments. Thank you.
Thank you, Jeffrey, especially for sharing how important it is for students to be connected to the work that can happen through community. So really excited to hear from the rest of our scholars. Pooja is up.
Sorry, I didn't realize I was on mute. Hi, everyone. My name is Pooja. Thank you so much for having us here today. So I wanted to present on my project that I've been working on with the Maryland Citizens Health Initiative Education Fund, and I've been working to help support their initiative called the Prescription Drug Affordability Board. So just some background, the Maryland Citizens Health Initiative was established over 2 decades ago, and it's designed to mainly educate Maryland citizens about ways to which to expand access to affordable, high quality healthcare in the state. And one of the most important initiatives that they've spearheaded is the Prescription Drug Affordability Board, which works to make these high cost prescription drugs more affordable for Maryland citizens. And Maryland, interestingly enough, is actually the first state to have such a program, which is very exciting. And it's widely known that many Marylanders unfortunately struggle to afford some of the prescription drugs that they need. And they often have to choose between these medications and other basic needs such as rent or food. And especially during the COVID-19 pandemic, some of these disparities have been exacerbated. So I was really happy and fortunate to help support these efforts. The specific goals of my project were to help leverage my clinical experience and context to further the mission of the Prescription Drug Affordability Board. And my efforts have really been twofold. One is to help anthologize real patient stories regarding their experiences with prescription drugs. And then 2, to engender support for the PDAB amongst the clinical community in Baltimore, including the Johns Hopkins and the University of Maryland community. So in terms of my activities through the Source Scholars Program, I've been working to collect patient stories about their experiences with prescription drugs and any pain points they've faced, and what, from their perspective, could make prescription drug affordability what could improve prescription drug affordability in the state. And this was very enlightening to me because I had the opportunity during my regular clinical rotations as a medical student to sit down with patients across a variety of disciplines, from women's health to just internal medicine to more specialty fields, including plastic surgery, and just talk to them about their various struggles and really understand their personal stories, which is very meaningful to me as a future healthcare provider, because many times we're taught to understand the disease and prescribe the medication, but not necessarily really understand what happens after the prescription is given. So it was very eye-opening to me to participate in this work, and it was very enlightening. And I also had the opportunity to attend the Maryland Citizens Health Initiative Education Fund's community listening sessions to kind of get a perspective of the community's overall gestalt regarding prescription drug affordability in Maryland. And here I have a picture of one of the example town hall forum advertisements, and these were conducted virtually this year due to COVID-19. But they were very enlightening discussions featuring many legislators, also community participants from the community, as well as participants with more of a clinical background as well. And I've secured stories and testimonials from 11 patients thus far, and continuing to work on that, and also support from 6 clinical organizations for the PDAB as well. And in terms of sustainability, I am working to create a database of both patient and clinical contacts that the PDAB can continue to leverage even after my school year is over and I graduate this May. And I'd really like to give a huge thank you to the SOURCE team, also to Suzanne from the Healthcare for All project. She has been a wonderful mentor to me in terms of helping me understand the issues and also getting me involved, and also Catherine Kirk-Robbins as well, who has also helped me get on board with the projects. So thank you.
Thank you, Pooja. Next up, we have Kelsey.
Hello, everyone. My name is Kelsey Williams, and I'm a Master's of Science of Public Health student in the Population, Family, and Reproductive Health Department. My project was the Education to Independence Health Education Workshop program at Project PLACE, which stands for People Lacking Ample Shelter and Employment. This is the mission of Project PLACE is to provide temporary housing, permanent housing, and supportive services, which range from connection to medical care, to job training, to homeless adults and families in the Baltimore area. And so we serve folks with mental illnesses, HIV, addiction, developmental disabilities, ex-offenders, and really anybody who needs to come in and try to cater to their needs to serve the whole person. And Project PLACE serves about 150 adults each year in the Baltimore community. And it started out as just a walk-in center and has been expanding to have more and more temporary housing facilities. So it's a really great organization. The Education to Independence Workshop program was started last year by another service scholar. And it is essentially a workshop program that happens once a month at each of the temporary housing shelters to educate residents in an engaging format on health issues that affect their lives. So they did about 12 workshops last year, and we've done 14 workshops thus far this year and have planned out into the summer on topics including bipolar and mood disorders, HIV/AIDS, PTSD, personal wellness, substance use disorders, summer heat and safety, hypertension. We brought a physician in to talk about the COVID vaccination efforts and to do myth busting and answer questions surrounding that. And we also try to provide residents with connection to care if they desire that, or worksheets to further engage in the health issues, or community resources such as connection to the library or connection to walking groups or outdoor activity groups, if that's what they're looking for. So I also was brought on to hopefully do some focus groups with residents and learn their feedback. We do, at the end of each workshop, we do a survey and they tell us what they think, and we were hoping to do focus groups to create a sustainability manual for the program, because they're hoping, Project PLACE is hoping to keep this program running over time, and to better engage students and community members as volunteers, and to create volunteer engagement efforts, events, but in the COVID world, all over Zoom. So definitely the Zoom format was one of the biggest challenges that we had. It's really hard to create a super engaging workshop with folks on a small computer that's projected into a screen, on a screen in a room where we don't really have good microphones. So we did the best that we could there, and I think we had some pretty successful workshops. We engaged a number of volunteers, both from the graduate schools and undergraduate schools and in the community, and we brought in guest speakers, as I noted. We submitted 6 grant applications because we do try to provide gift card incentives for residents to attend the workshops. And we have focus group guides developed that we will be conducting hopefully in person this summer once everyone is vaccinated, and we're all pretty close to being, the entire team's pretty close to being vaccinated. And because of the COVID vaccination myth busting workshop, I was told personally that a large number of residents changed their mind on their vaccination and decided to get one. So that was a huge success, if nothing else. So ongoing challenges, we haven't had any successful grant applications, so we're really looking forward to hopefully continuing to solicit funds. I'm supporting the transition to the next Source Scholar, as well as my preceptor is leaving and transitioning a new person into her position. So I will hopefully be supporting that transition in the next month. I think that the biggest lesson that I learned was to take the time up front to recruit other volunteers and to delegate tasks rather than trying to hit the ground running with all of the things that I have envisioning. Things certainly fell by the wayside at times, and we all sorted it out, but I think as a project manager, that'll be something I do differently next time. I think this was a great learning experience to be flexible and relaxed about scheduling. Many times, events fell through and we had to reschedule at the last minute, or somebody wasn't able to join the call because of tech difficulties. And at this point, if anything goes wrong on Zoom, I'm just not going to miss a beat. And so I think that's just been a great lesson, is that, when scheduling falls through, it doesn't really matter. And then lastly, maintaining ongoing and inclusive communication, CCing everybody who might need to be CC'd on every email, and chatting more often rather than less often has really made sure that all of these workshops every month, one at each location, have continued to be successful. So huge thank you to everyone with Source and everyone at Project Place for making this such a wonderful experience. I'm really looking forward to staying engaged a bit over the summer and moving forward. I still have another year at Hopkins. And yeah, feel free to drop questions for the end. Thank you.
Thank you, Kelsey. Next up, we have Katie.
Thank you everyone for coming. My name's Katie. I'm a second year PhD student in the School of Nursing, and I had the privilege of working with Roberta's House, which is a great organization providing grief support to children and families throughout Baltimore City and beyond. They're a growing organization. So anybody suffering the loss or death of a loved one. And as a hospice nurse myself, I came into this experience super pumped about the mission of Roberta's House, because I often get to, I care for people up until the end, but then I don't get to, stay involved after that and sort of see how we can support people on their grief journey. So this was such a treat for me. Essentially, my role in this project was to help support the volunteer program and enhance what they already have going on there. So we sort of grouped our tasks into different categories around the 4 R's. So the first thing we did was to sort of think about something that could help systematize the routines and the way that they do things there. So we launched an electronic system in January so that volunteers will no longer track their hours on paper. So yay. And I helped develop and implement the training for the volunteers and the staff on that. So thus far, we have 91 volunteers in the system. 39 have been able to successfully access the online portal, and we have 22 people that are actively logging hours. And so this graph in the middle sort of shows this, we're seeing the trend in the right direction. People are getting more comfortable with such a big change to the routine as time has gone on. Our second sort of area was to target recruitment efforts. And so this involved creating a needs assessment survey for the staff and volunteers to identify what their needs, their interests are, and any areas for improvement. We only had 3 responses, but we didn't really incentivize it. We know that, people get really burned out from filling out too many surveys, but following this project, Roberta's House is actually partnering on a pilot study through Johns Hopkins, and so the survey that we created will be adapted and used as part of that study. So they'll still get to gather some of that data that we were hoping to get from the volunteers. And then the last category was enhancing retention and recognition, and so this involved creating spaces for people to basically just decompress. We did a bingo night, which was super fun. And Kelly, the volunteer coordinator, does a great job of hosting weekly check-in meetings with the volunteers as well, just to, you know, talk about current events, things that are going on, opportunities for getting involved. And then our biggest sort of endeavor was to create a virtual drop-in peer support group for anybody who has been affected by loss related to COVID-19. And, you know, it affects essential workers, it affects volunteers, it affects virtually everybody who's experiencing some sort of grief and loss as it relates to COVID-19. And so we wanted to create sort of an informal space where people could come together and sort of decompress. I recruited and trained up 7 volunteers who serve as the facilitators for this group. And so far we're sort of piloting it to see sort of what the interest is, what people, if they find this to be a helpful space or not. So we've done, we're doing 6 sessions that will go through the end of May. So far we've had anywhere from 0 to 7 participants per session, and they've found it to be helpful so far. Biggest lessons I learned is just the value of developing mutually beneficial partnerships, because it really is so critical for creating change that's going to be sustainable. As many people have sort of discussed, you know, COVID-19 has thrown a wrench in everyone's lives, but just exercising the ability to be able to pivot processes, and anytime you're making sort of a change like this launch of the electronic tracking system, everybody adapts to changes differently. And so just honoring where people are at in those types of changes. And then also just the you know, recruitment and strategizing how you're going to recruit people and engage people in different tasks is really important to think through, more so on the front end, rather than, you know, gaining gray hairs as you're going along, trying to pick up speed as you go along. So that was a key lesson learned as well. So thank you to the Roberta's House staff for this great opportunity, and to Veronica and Kelly, my 2 preceptors at Roberta's House, for all of their mentorship and guidance throughout this process. I'm super grateful for this opportunity. So thank you.
Thank you, Katie. We are at our last scholar, so Medi's on deck. After this, Tony will close us out, and then I would love for folks to stay on so we can have a picture. Medi, you're up.
All right, can you all see my screen? It seems I'm the only one using PowerPoint, so I joined in late, so I didn't know if anybody else is, but anyway. Oops, somehow this is. Okay, hello everyone, my name is Mehdi. I'm a part-time MPH student at Hopkins and also full-time staff scientist at the NIH. I worked as a source services scholar with House of Ruth Maryland on this project called Hrm Storytellers, Survivors of Intimate Partner Violence Speaking for Change. I'm sure most of you are familiar with House of Ruth Maryland, but very quickly, Hrm is one of the leading intimate partner violence organizations that helps thousands of survivors find safety and security that basically most of us take for granted. And Hrm leads the fight to end IPV by confronting attitudes, behaviors, and systems that perpetuate it, and also providing survivors with the services that is necessary for them to rebuild their safety free of fear. So the specific project that I worked on was the Hrm Storytelling Initiative. And the initiative proposes to organize, train, and support intimate partner violence survivors to effectively share their stories with both other survivors, abusive partners, and also the community at large. And really the aims of the projects, I think, are twofold. One is to increase the participants' sense of meaning and purpose and control, and also to make bigger changes and change the conversation and the policies around intimate partner violence. So this is a very, very quick summary of some of the things that I was honored to do and had the opportunity to work on. Basically, we had bi-weekly meetings with the storytelling graduates. So the program had been run before, and we, at the beginning of the my internship, we did one-on-one listening sessions with all the storytellers of previous graduates to get their thoughts about the next cohorts and how the program needs to be evolved. we developed a peer-led curriculum draft, which is now being reviewed by the clinician at HRM, and hopefully that will be finalized soon. We had a whole establish a new webpage. Obviously, this is not all my work. I just contributed to the HRM has a really great, like, tons of the staff that they support the entire organization. And also we, most importantly, in 2 days on Friday, actually, we are having a virtual event trying to get the word out there, introduce the program, and also launch the next cohort of the storytellers. We had a social media campaign back in October, and we reviewed the quotes, and I do have some pictures of that at the end that I'll show. And finally, we had the opportunity to match with the stigma course at Hopkins, and some of our storytellers, basically they attended one of the sessions and it went really well. Very quick summary of some of the outcomes that we had. As I mentioned, we have developed a draft of an 8-week peer-led curriculum, which will be used. We launched a new HRM Storytellers webpage. We are going to have a virtual event on Friday that I'll invite all of you to attend. We have some of the information. Obviously, the social media campaign and everything else increased awareness of IPV. And also, we are working on a training plan for peer facilitators for the next cohort, which is now ongoing. So I just wanted to have some snapshots of how you can get to the website, because we are pretty excited about this. This is the Training Institute webpage under HRM. And as you can see here, you have basically an icon that gets you to the Storytellers project. And then if you get here, then you see a lot of information. You can basically join as a storyteller or request a storyteller. And again, I just encourage you to go and see. These are all really nice quotes and talks about, like, short stories from the storytellers. And this is a virtual event that we are going to have on Friday. So if anybody is interested, I already sent to the Hopkins email, so you can all attend and learn more about the program in general. And in the virtual event, we are going to talk about the history of the program, launching the website. Most importantly, we're going to hear from storytellers, and we're going to have some Q&A at the end. So just wanted to thank, basically, first and foremost, all these storytellers that provided this opportunity for me to get hands-on experience. Jocelyn and Lisa, my preceptors, and obviously Kiala, Tony, and Madison at Source. Just wanted to end with some of the direct quotes from the storytellers. I'll invite you to read them if you have time. Otherwise, they are on the website and also our social media platforms. And just wanted to end with basically a personal experience or example that this is a sticky note now on my monitor, a direct quote from one of the storytellers that really touched me, and I could personally connect with it, and just wanted to read it for you. That there is no truth to the statement that time heals all wounds. My grief always lingers at the edge of my conscience. So that's all.
Awesome. Thank you so very much for sharing that. And I think Jocelyn actually put the registration in the chat as well. So again, I just want to thank all of our scholars for the great work that you've done, especially all of our community-based partners who are also on here, for all the work that you are actually doing in communities too, and allowing us to be partners with the Source Service Scholars Program so that we can have students getting real hands-on experience working as a project manager on some of the great work that you're already doing in our community. So let's just give everybody a round of applause. If you could just clap your hands or put up the emoji or reaction or however you want to do it. You all have done a really amazing job. And I can't thank you enough on behalf of Source and Johns Hopkins for all the work that you've done this year. But before we end, if there is anyone that has any questions, I do want to give that opportunity and that space for folks to ask a question. I did not see any in the chat. I saw a lot of accolades, which is great, which means that all of our scholars did a really good job. And so you probably don't have any questions for them. But before we end, I did want to give you that opportunity and to let you know that for me, this is the culmination of National Volunteer Week. Although it's a week long, this is an opportunity for us to celebrate. Not just earlier today, we had an award ceremony for the work that our CDOs, student organizations, student, staff, and faculty are doing. And for me, this is a way that we can also celebrate the work that our source service scholars are doing with some great community partners that we have here in East Baltimore and across the city. So once again, I want to thank you all so very much. And I don't believe I see any other questions. So before I leave, though, I do want to end by giving the opportunity for our scholars at least to, in a one word or phrase, sum up your source service scholar experience for everybody that's on here. It can be something really quick, and I'm going to call you all out, but at least I want to do that just so we all know what your experience was like in one word or one phrase. So I'm going to call Anna first, since she started.
I think fun.
I love it. Who? Akane? She's still on here.
I am still on here. Hi. My one word is artsy.
Artsy. Got it. Alicia.
I would say eye-opening. That's 2 words, but
yeah, it could be a phrase. I love it. Jen.
I will say the last phrase of my reflection letter, which was, I made just a little thing.
All right. Leka.
I think I would say just like friendships to reflect those that were formed.
I like it. Sydney.
I think I would say important and innovative.
Okay. Christina.
I want to echo that eye-opening.
Jeffrey.
I'll go with educational.
Got it. Pooja.
To use a synonym, thought-provoking.
Okay. Kelsey.
Grounding.
Katie.
Impactful.
Last but not least, Maddie.
Okay. Katie actually stole my word, so I was, but I was going to say touchy and impactful.
Got it. I love it. I love it. Thank you all once again for this wonderful experience of working with you and the experience that you had working with our communities. If I had to say one word, I would say nimble, because you all, especially during the pandemic, have really been as creative as possible and as nimble as possible to actually do the work that you've done during the pandemic in this virtual experience. And so once again, we all appreciate the work that you've done. And I see Mindy's on here. Mindy, I don't know if you wanted to say anything.
I sure do. Thanks so much.
Yep.
I want to congratulate all of our source service scholars, and a huge congratulations to all of our community-based organization partners. They all really showed up in very meaningful ways, and it's very evident in the work that you've shared with us tonight. So we're thrilled that we're recording and sharing with others so they can see. But I also want to thank Madison, Tony, and Kiala for keeping this program going. Y'all are amazing. It takes this whole community to make this work, and because of y'all's dedication, your wisdom, your courage, your vulnerability, y'all have just shown up in so many meaningful ways. And again, the word of the year has been pivot, and every single one of you have done that. And I just want to celebrate the work that you have done. And you're forever a part of our source family. Thank you so much for everything that you've done.
I love it so much. I'm mindful we've stolen time from you, 10 whole minutes, but I am deeply grateful, that's my word, for all that's taken place tonight and for all of you. And if you don't mind, we're gonna smile for a quick picture. Madison's gonna count us out and then we'll let you go.
All right.
right, if everyone wants to keep smiling for just a little bit longer, and I'll go 5, 4, 3, 2, 1. All right.
Awesome.
Thanks, everyone. Have a great night.
Thank you all.
Thank you.